Our leases run month to month, so you're not locked into a long-term commitment, giving you the flexibility to move your belongings out the minute you purchase your new home. Stop by today or give us a call, 530-8003. That's 530-8003. Jessup Premium Storage.
They're cool, clean, and secure.
When you have an accident, you, not the insurance company, chooses the body shop, and you only need one estimate. All you have to do is call Jerome Riles at B&C Collision Center in downtown Scriven to deal with the adjusters and insurance company. Whether it's a little ding or a major crash, that B&C Collision Center across from Wasden Cabinet Shop in Scriven deal with the insurance company so you don't have to. Call them at 579-2274. That's 579-2274.
And good morning to you. It's 7:59 in just a few seconds. It will be 8 o'clock. You're listening to WIFO FM in Jessup. WIFO FM in Jessup. Good morning to you. 105.5 on your FM dial. Butch over here with you on Martin Luther King Day. Kind of chilly outside right now. We're right around 31, 30, 32 degrees according to where you live. In town, it's a little warmer. Out in the county, it's a little cooler. Going to have a high today of around 60, around 53, around 53, around 53 degrees for the high today. And kind of breezy, so the wind chill factors could make it feel even colder. And then tonight, low around 27 tonight. And then tomorrow, sunny with a high near 48. Bob, can you believe that? The high tomorrow is going to be 48 degrees.
Oh, well.
Oh, well. Can't do nothing about it. We can talk about it. Low tomorrow night. It's going to be around 26. So we're going to have a couple of really cold nights here, about 2 or 3 really cold nights in a row. And the audible humber level is 11.5 feet and falling. Currently here in southeast Georgia, like I said, it's between 30 to 32 degrees according to where you are. All right, it's now time for the world-famous Butch and Bob Show, and it's brought to you by Mike Birch Ford in Blackshear, by B&C Collision Center in Scriven, and also brought to you by, let's see here, also brought to you by Jessup Premium Storage on the White Cross Highway, and by Mike Birch Ford in Blackshear, and by also Jessup Premium Storage, and by Parker Insurance and Realty located on Macon Street in downtown Jessup. Well, Bob, we got some special guests in here this morning on world famous Butch and Bob Show.
Yeah, it was hospital day. Joe Blizzard has brought in Dr. Thomas Chasse, who's got a special seminar coming up, I do believe. So turn over to you, Jill.
Jill, what's he going to be talking about? I think it's something that a lot of wives out there would like to hear about, right?
And maybe some husbands.
And maybe some husbands, too.
But first, I just want to say thanks for letting us come in once a month for Hospital Day. We're really excited to share with the public what all we have going on at their local community hospital. And with a new year brings new opportunities. So once a month in the year of 2016, we are going to host a physician lecture series. So it's once a month. It's always going to be the fourth Thursday of each month at 6:30 p.m. at Coastal Pines Technical College, back in the C. Paul Scott Polytechnical building where the Chamber Gala is held in the back of the college. And our first physician that is kicking off this series is Dr. Thomas Chasse, ENT surgeon. And I believe he's going to be talking about snoring and sleep apnea. So,
yes, Dr. Chasse, good morning.
Sorry, I wasn't awake. No.
Yes, like me, my brain is not kicked into gear. I think I gave every one of the sponsors this morning double because I was trying to do technical stuff here and try to think what I just said at the same time. And then Jonathan was doing some stuff. So my mind was kind of not in focus there. But Dr. Chasse this morning, ear, nose, and throat specialist. So tell us what the seminar is going to be about.
Well, first, before I get into that, Butch, thank you, Bob and Butch, and for hosting us and wishing you and all your listeners a healthy and happy 2016.
All right, thank you.
And I hope you all had a good night's sleep. But if you didn't, maybe it wasn't just remorse over the different ball games that I have a friend who runs a pub in Maine where I'm from, and he says if you run a pub, you're going to be successful after any kind of sports game because there's going to be those who are happy and there's going to be those who are sad, but they're both going to be drinking.
Celebrating
or remorse.
Or remorse, yeah.
As Joe was saying, the town hall meeting coming up on January 28th at 6:30 in the evening, I think, is going to be on something that I feel quite strongly about, upper airway obstruction. And I wrote an article for the local newspapers and things called breathing, snoring, and a good night's sleep. So, snoring has been made jokes of, and certainly where many people, as we alluded to earlier, husbands, wives, children, colleagues, snoring can be the sign of many, butt of many jokes, so to speak, but also it can be a very serious health issue in that snoring is merely the sign of upper airway obstruction, for you can't breathe normally. And obviously, if you aren't breathing well, it's hard to function well, particularly hard to get a good night's sleep. And I'll use an example. Many years ago when I was practicing in New England and Boston area, I had one of the big accounting firms used to send out teams of 2 to do audits and things. And I saw this patient, and his snoring was so bad that he was in danger of losing his job for the following reason. The colleague he went with wouldn't sleep on this. They used to share rooms. That was right, was expected. He wouldn't even sleep on the same hotel floor as this guy.
Oh my word!
So they had double the expenses of lodging and things. So it can be quite a serious issue. And what I wrote in the article, which is pretty straightforward stuff, is that snoring is a sign, as I mentioned, of upper airway obstruction. And from my point of view, there are 3 areas of the upper airway. There's a nasal, we'll call it, nose, the upper throat, meaning your palate and the palatal area, and then the lower throat, which means the tongue level and the chin level. And so people who have snoring will have upper airway obstruction at 1, 2, or all 3 of those levels. And of course, that can be positionally related, whether you're on your back or your stomach, weight related to some degree. But it isn't always the sort of classic heavy-set, middle-aged guy who's snoring. It can be a very trim young woman who has just the airway anatomy of obstruction. And this can also be an issue in children that is becoming more and more prominent. The whole concept of sleep apnea, which is what we're talking about, so the inability to breathe normally during sleep, has become a huge medical problem in the United States, starting to be recognized really probably actually when I was in my residency at UCLA. I remember giving a talk on this. We're talking 1986, so I'm dating myself, and it has become quite prominent in medicine. And it's almost hard to see patients who, in a day of 20, 25 patients, of which several don't have CPAP or some breathing device at home. Mm-hmm. Okay? And so the reason I'm talking about it as an ear, nose, and throat surgeon is that there is a physical obstruction of those 3, 1 or more of those 3 areas that we spoke about, nose, upper throat, lower throat. And most patients now never see someone who's an expert in that area of anatomy and treatment. They may see, luckily they're seeing somebody, their general practitioner who orders what's called a sleep study. It's a test either done in a sleep center or at home now, where you're monitored as far as your sleep levels, because there's different phases or stages of sleep, your blood oxygen levels, your heart rate, and other things like that. And more often than not, that patient who's had a sleep study that shows they have sleep apnea is immediately treated with CPAP. And CPAP, CPAP, means continuous positive airway pressure. Basically, you're trying to blow open an obstruction. Mm-hmm. And the success of CPAP is quite great if it's used effectively. And there's the challenge. Because
using it effectively is the challenge, as Dr. Chasse.
Using it effectively is the challenge because, one, I don't know if anyone has ever had this one, I'm sure some of your listeners do. It's kind of an unusual device. It's either blocking your whole mouth and nose. It's like wearing an oxygen mask or an oxygen cannula for your nose while you're sleeping totally. So right. It's a tubing hitched to a machine that's forcing air into your upper airway. The best studies show that the most compliant, except for somewhat of a small group, would be 50%. So that means someone's using it 3 nights a week, 4 hours a night, which isn't really effective. It's like taking your blood pressure medicine every other day.
Right.
It's not quite what the idea was. So compliance with CPAP, particularly if someone has significant obstruction, Butch, because the pressure of air to open that blocked airway, to keep the airway open, could be quite a lot. It'd be like sort of a tire pressure.
Right.
It's measured in centimeters of water, but when you get above a 10 pressure level, that's a significant airflow. I mean, it's not subtle in any way. So my goal is to make people aware of sleep apnea, which most people are, one, and two, that there may be very legitimate anatomic reasons why you have sleep apnea and snoring and airway obstruction that may be able to be treated permanently with some kind of surgical correction or some other means than CPAP, although CPAP truly oftentimes is needed.
Okay.
The more severe it is, the more it's needed.
Right. So, what you're saying is that the CPAP can help folks if they use it correctly, but it could be just covering up something that could be treated through surgery where maybe they may not have to wear that all the time, and also be on, I guess, solve the problem instead of just throwing air in your nose, right?
Correct.
So solve that problem, and so you don't have to wear it the rest of your life, and also possibly even be healthier.
Correct.
Okay?
Because you can't be healthy without getting a good night's sleep, for sure.
That's true.
And you can't be a healthy child, and you can't be a healthy child learning in school, and you can't be a healthy adult, and without a good night's sleep.
Got to get that good night's sleep.
Really do.
Very important. Very important. So it could be obstruction anywhere from the lower throat to the upper throat, anything in the nasal area. And what do you do, Dr. Chasse, to determine where that blockage is, and what treatments do you do to try to help relieve that blockage if they have it?
Well, to me, what I do is examine the patient, and usually it's quite obvious. I'll give a personal, within 12-hour example. After the Denver-Pittsburgh game yesterday.
Poor Bob.
Some friends of ours who are all from Colorado came over for a sort of late dinner. And one of the people was someone visiting from Colorado, and he was talking about his sleep apnea, which wasn't really, and I could just tell he was at my dinner table at my home, he has a very receded chin. So that means his tongue, chin level airway is going to be very narrow, and he's on CPAP in Colorado.
Right.
All this stuff. So it really can be just even across the room. Of course, you can't examine the nose, intranasally across the room, or the upper throat, meaning the the tonsil palate area. Certainly, the chin level is the make and break point, to tell you the truth.
Okay.
So what's called retro, which means behind, lingual means tongue, airway is sort of the bottleneck of the whole process. So.
Okay.
And my experience has taught me, and I'm treading carefully here, Bob and Jill, that men who wear beards frequently don't have a prominent chin. And, and you'll know, actually one of my older brothers has always worn a beard, and if he took the beard off, I think once for a very short time, I really noticed his chin was quite receded. And I'm not saying, present company excluded, I guess, looking across the room here. So certainly, if you have nasal obstruction, certainly surgery can help that dramatically. I think there's some personal examples of that. Upper airway, uvula palate, or tonsil obstruction can be relieved surgically. And the chin level becomes a more challenging process. Certainly there are treatments for that, even sometimes a dental appliance that keeps the tongue forward, because it's really the tongue position that matters, may be helpful. Surgery itself kind of came out of the starting blocks, again, in the mid-'80s here in the United States for sleep apnea, and it kind of fell into a disuse period because the standard procedure done was an operation to shorten the palate, called a UPPP. But if that really wasn't the problem, if the patient really didn't have enlarged tonsils and palate, then that surgery wouldn't be effective. So surgery, if you look at the statistics, isn't really in and of itself effective, but that data is kind of a little bit outdated because you have to look at the anatomy and decide whether surgery is helpful, and if so, what is it going to be?
Right.
Kind of thing. So
does TMJ have anything to do with the positioning of anything to cause or not cause snoring?
my answer would be no,
No.
not that I'm aware of.
Okay.
So.
All right. Now, Jill, you've got this seminar coming up with Dr. Chasse Thursday week. Is that correct?
It is Thursday, January 28th.
And where's it going to be?
6:30 at Coastal Pines Technical College in the C. Paul Scott Polytechnical Building.
Okay. Now, is this open to everyone? Free
Yes.
lecture?
Open to the public. We would really love you to come. There's no charge to attend. You don't have to pre-register. We're going to make it as easy as possible for the public to attend. And I would just encourage people to come and check it out and listen. You probably can tell just by listening to the show so far that Dr. Chasse can hold your attention. You will be informed. You'll also be entertained by the topic. So if you snore, or if you know someone who does, or if you know someone who may be looking for an alternative to the cumbersome CPAP machines that are used at night by a lot of folks out there, I would just encourage you to come at 6:30 Thursday, January 28th. And he's also going to offer a question and answer session
Okay.
at the end.
Dr. Chasse, you're going to start this lecture at 6:30. You'll have a lot more information, of course, that you're given this morning. How long will the lecture go on for?
As long as
As long as they have questions. Okay.
Correct, yeah.
But your part, just talking, starting.
Oh, probably 20 minutes or
20
so.
minutes or so, you'll sit there and just talk about the
Right.
different things. But, for a lot of couples, that's a big problem. With one or both of the couple there, one of the partners snoring or both of the partners snoring, from the health issue of having sleep apnea is, as you mentioned, maybe people are not aware of that. I really wasn't aware of the health problems until you and I started our conversations this year.
Mm-hmm.
The health problems you can have with sleep apnea, because you cannot get that full night deep sleep because you're constantly waking up because you have that obstruction in your throat where you're not getting air and your body wakes up and then you got to go back to sleep again.
I want to emphasize one thing as well. So let me just sort of summarize what I've said so far. I don't know how much time we have.
We have plenty of time. Yeah.
So certainly, surgery can, that's kind of graded. For mild to moderate sleep apnea, surgery could cure it and be done.
Mm-hmm.
For those with more severe sleep apnea, surgery may make the CPAP that they will need to use far more effective and then far more tolerable.
Right. You're not going to push so much air.
Correct. And
Right.
that's the whole process. So a rule of thumb that, again, in this article, I think it's been in the local paper, maybe, I'm not sure, is a well-rested human being is, I always think of like a supercomputer called a Cray computer, will take about 15 to 20 minutes to fall asleep.
A supercomputer.
Yeah, because we're
Okay.
shutting down the supercomputer that's our brain.
Okay.
But if you're sleep deprived, and that can be from quality or quantity of sleep.
Right.
So if you go to bed at midnight, get up at 4, of course you're going to be sleep deprived no matter how well you're sleeping. But it's called a 5-minute rule. If you lie down and you're out in less than 5 minutes, that means you're sleep deprived. And then you have to figure out why are we sleep deprived,
Right.
quantity of sleep or not. So for adults, of course, that leads into poor job performance, perhaps. There was I went to a conference of this back in Boston a while ago, and one of the presenters was the head of sleep medicine at the University of Pennsylvania, where I went to medical school, just by coincidence. I didn't know him. And he had been at a meeting with the Department of Transportation, because sleep apnea and sleep disturbance among truck drivers is a huge national issue.
Oh, yeah.
And they were debating a variety of points. And I remember this physician giving this lecture saying that they were trying to determine, basal metabolic index is basically how heavy and broad you are to determine. So if you have a BMI of greater than, say, 25, the odds of having sleep disturbed breathing are great versus those who don't.
Okay.
And they were trying to debate among the big trucking companies in the United States and the Department of Transportation, what level of BMI would the driver need to have a mandatory sleep test? And that apparently went on and on for hours in a federal, conference room somewhere. So this is a huge recognized problem in adults for sure. Becoming more and more recognized, and that's what the thing I want to emphasize as well, in children. Certainly, you know, ear, nose, and throat surgeons, people think of tonsil surgery.
Right.
And no question that was done a lot. Back when I was a kid, I think you just had it as a rite of passage. But actually, there was streptococcal infections were far more serious then. But nowadays in the United States, tonsil surgery is one of the most common, but it's actually done far more commonly for airway obstruction in children than for infectious reasons.
Didn't know that.
And so it's the classic symptoms. So if you have a child who's not well, sleeping well, I should say, excuse me, if you have kind of a child with an irritable attitude, poor school performance, two telltale signs. If I always ask the parent this, if you tuck Johnny or Susie in bed, the next morning, are they all nice and neat, or does it look like World War III happened? And they always say World War III happened. That means that child is always constantly moving and finding a position of unobstructedness. And sometimes parents will say,
that sounds like me.
Okay, so sometimes parents will say, we never let Johnny sleep in the bed with us.
Right.
And, he's all over the place. So if you have that kind of child's motion, you might want to evaluate their breathing during sleep. There's no question that I shouldn't say much of it, a number of patients and children who've been labeled with one of these alphabet ADHD and stuff either have poor sleep, therefore they lead to poor inattentive nature in school and at home. And so a lot of that's being recognized. Wow, we got to make sure these kids can breathe too.
Yeah, it's so important. The more research you do, more reading that you do, that getting that 7 to 8 hours of sleep each night is so important. And as you mentioned, not only the quantity but the quality of sleep, and making sure that you're sleeping through the night without waking up and tossing and turning because you have that blockage in your nose or your throat. Correct. And so this seminar coming up on next Thursday week at Polytech Center, starting at 6:30. Free lecture with Dr. Chasse. He's going to be talking about sleep apnea and snoring and how to cure, prevent, and treat each one of those situations there. And the floor will be open for questions that you can ask Dr. Chasse. We always wish we could get around doctors and talk to them about different problems. But you don't want to walk up to them in a store somewhere and say, "Well, Doc, it hurts when I do that." Well, you did have that at your table the other night, didn't you? Last night, didn't someone start talking about that? I mean,
well, it's not uncommon at all. It's fine.
It's just part of the. Well, I would consider it part of the recruiting process of new patients. Is what I would do if I was a doctor. Well, come in and see me. Call the office.
Actually, 2 people last night couldn't do that. There's only 6 of us there. My wife and I went too. I also want to emphasize that during the question and answers, as far as I'm concerned, you can ask questions about anything that would be involved in that specialty.
Yeah, anything with the ear, nose, and throat. Right. It doesn't have to be snoring. Doesn't have to be sleep apnea. Anything with ear, nose, and throat. If you got problems with the ears, which a lot of folks do, the throat, the blockage in it. I know the older I get, the harder it is for me to eat food and swallow. I have to chew more, and also have to eat slower.
But you're looking trim.
I'm sorry. Yeah, you block it up where it can't get your stomach. You're gonna lose weight, right, Doc? And anything to do with the nose. And so any of those subjects right there, any of those part of your head that you want him to talk about, he'll do it. Plus the main subject of sleep apnea and snoring, of course, is the main part of the lecture, but anything to do with ear, nose, and throat coming up on the seminar. Once again, that date again, Jill, is?
Thursday, January 28th, 6:30 p.m. at Coastal Pines Technical College.
Absolutely free at 6:30. Everyone's invited. And I'm sure you're looking forward to kicking off this lecture series with the hospital. I mean, you're going to be the first one.
Yeah, I actually wasn't aware of that until I signed up.
And I've seen Dr. Chasse as a patient since this past summer now. And matter of fact, I've got an appointment this morning with you at 10 o'clock, Dr. Chasse.
Oh, okay. Let's just do it right now.
We're on live TV right now.
Yes,
on the radio.
Yeah. Well, we are on TV too.
All right.
Yeah, little camera right back over there. But luckily, it's very hazy.
It's very grainy.
It's very grainy. We do it just for the fun of it more than anything else. But I've got. But getting back to what you were saying, you've taught me won't say taught, but you've informed me so much about the problems that we're having. I went through the surgery around Labor Day weekend. Right after that, basically doing the roto-rooter up my nose and sinuses and everything else. I heard somebody else say that the other day. It's just not only me. Cleared it all out and everything like that. And I got another follow-up appointment. I like the way that your office works. They send you the follow-up emails. They give you a call and emails in advance to remind you of your appointment and do all that. But Dr. Chasse has got great bedside manners. He's fun to be around and talk to. Same guy that did some surgery with me back in the 90s up in Aiken, South Carolina, Dr. Tom Cofer, was just like you. Just fun, cutting the breeze, but very good at what he did. So
Thank you very much.
it's going to be a great seminar. Folks need to go to it. If you have any situations with you or a family member or friend with ear, nose, and throat, free lecture Thursday week at Polytech Center here in Jessup. Dr. Chasse, what else is going on in anything that you on your mind this morning other than just talking about sleep apnea and snoring? Anything else that this time of year with the cold weather and the changing weather and all that, anything you to look out
Thank
for?
you for reminding me now that I think about it. If I could make one piece of advice for anybody who lives in coastal Georgia, for yourself or your children, put a humidifier in your bedroom.
Now, why you've emphasized that to me, and I'm going to be honest with you this morning. I don't do it as regular as I should.
So basically, the upper airway, the nose, we'll just say the nose, functions to heat, humidify, and filter air you breathe, whether you're in the Arctic Circle or the Amazon or anywhere in between. So if the nose would like to be in Tahiti, maybe. Jill, let's go to Tahiti, okay?
Let's go.
Let's go.
And so about 40% humidity, maybe 75 degrees. So if we look at 40% humidity would be great for the nose. The Sahara Desert is 25% humidity. So I'm sure this room right here and your home and your office is probably 0% humidity because we're either air conditioning it or heating it.
And that dries the air,
Correct.
which
So that-
Dries your nasal
Correct,
passages.
which means that particularly if you're breathing better than you did before, you realize that your nose has to do more work. So you might, humidifying. But that whole dryness, the upper airway has mucus over the cell, the membrane called mucosa, and that's a protective layer from bacterial and virus infiltration into the cells, if you will.
Mm-hmm.
So if you have a very dry airway, you're more likely to get colds and things like that.
Right.
So if you have a more humid environment, your frequency of upper airway infections or viral infections or colds will be significantly less.
Okay.
And important from a cosmetic point of view, your skin will stay younger longer.
That's right.
So if you go to Walmart, I'm sure I'm not supposed to say that. Go to any little place you want, buy a Holmes Air thing, but I happen to see the name Holmes in front of me on some gizmo they have here. That's a common company that makes humidifier. It doesn't matter if it's hot or cold.
Humidifier, vaporizer, same
thing,
same thing. Okay.
Yeah, and it doesn't need to be an air filter or an air purifier. Just add moisture to your environment,
Okay.
particularly when you're sleeping. Because that's where you're going to be stable for hopefully 6 to 8 hours a night.
Yeah, that's right. I have to keep the lotion on my hands tremendously this time of year because, I like to keep the heat of the house around 70. Other folks in the house want to keep it around 75. And so it just dries out everything when you got that heat coming out of those vents all the time.
Right.
And so that's something that people need to be aware of. There is keep a vaporizer, humidifier in your bedroom at night, especially when that air's running a lot or the heat's running a lot.
Correct.
Yeah. Your nose likes moisture.
That's the tip for the day.
That's the tip for the day. Probably our ancestors here in South Georgia probably didn't have that problem years ago because, they didn't have the air conditioning and so forth, and we just all sat on the front porch and stayed outside under the shade tree or something like that. We didn't have all that. But today, it's a whole different ball game. I was trying to get this on the screen here, but I'm having problems with my screen this morning. Sometimes when I move it, it just dies on me. There's me a loose wire right there or something.
Being from a different environment, I have my windows open unless it's intolerably hot or cold here.
Mhm.
But it's quite interesting to me that when I ask patients about on this subject matter,
Right.
almost no, can't think of anyone I've asked this question like, do you ever open your windows in your house? They never do.
Yeah, they don't,
They never do.
No, they're closed all the time because it's either just as hot as out of the water or it's cold.
Right.
You got very few days where you can actually have them go through there. You got to have screens on there. If not, you'll get a house full of skeeters and rats and everything. So you got to have good screens on there. Good Lord, I remember in Jacksonville back in the 60s, I had relatives, a lot of relatives didn't have air conditioning, but they had one of the big old attic fans that set up there, and you crack the windows a little bit, and that attic fan would just pull that wind up through the windows, up and through the attic, and send it out. And that was the air conditioning back then.
Mhm.
Yeah, but today we've got to have it just certain temperatures. But once again, Jill, I want you to talk about the seminar and then move on to what else you want to talk about.
Okay, so we just want to remind folks that if they know anybody who snores or isn't getting a good night's sleep, we would encourage them to come Thursday, January 28th, 6:30, Coastal Pines Technical College in the C. Paul Scott Polytechnical Building. It's free of charge, and you do not have to pre-register. 6:30 p.m. and there'll be a lecture led by Dr. Thomas Chasse, ENT surgeon, and then he'll conclude with a question and answer session.
And he also mentioned that because of being an ear, nose, and throat specialist, if you have in any situation with just not sleep apnea or snoring, anything with your ears and nose or throat, he'll be glad to answer those questions also.
Yes, great opportunity for some FaceTime with a physician in our community.
Okay.
And also, I just want to take a quick minute to remind folks of the next sale in our lobby. We have
Next sale!
another sale. We touched on it briefly
Oh,
last
have
time I
mercy.
was here, but it's January's time for the white sales.
Mhm.
So at the end of January 26th through 28th, 7 a.m. to 6 p.m., we have a white sale going on in our lobby. It's a great vendor, fantastic customer service, fantastic products. We're really excited to bring that to the community here.
I got it up on the screen now if you want to see it.
Oh,
There it is.
yes, there it is. Hi.
For some reason, I got to keep it in this right same, and it's about 20 seconds behind. So if you wave right now, Dr. Chasse, in about 15 seconds from now, you're going to see yourself go, okay, as it goes through the internet.
So that's January 26th through 28th, 7 a.m. to 6 p.m. in the lobby at Wayne Memorial, a white sale.
Okay.
And that's it. We thank you for having us.
What's that?
So someone going to the lecture at 6:30 could swing by the hospital before 6 on their way and pick up some sheets and stuff.
They sure could. Then they're all set for a good night's sleep that night.
Exactly.
All set. One-stop shopping. Here we go.
All right. Bob, any questions or comments or anything at all for Dr. Chasse or Jill?
I believe they covered it.
Believe we covered it all. Well, look forward to the seminar coming up.
Thank
on
you
the-
very much for
on
hosting
the,
us again.
What's the date again?
Thursday, January 28th.
28 to
6:30.
6:30 at the Technical College here in Jessup in the Polytech Center. All right. Thanks for coming in.
Thank you
I'll
for
see
hosting
you in a
us.
little while.
Okay.
All right, we'll be back. No, we're at the end of the time period. It's 8:30. All right. That wraps it up for the Butch and Bob Show. Butch and Bob Show brought to you by Jessup Premium Storage here on the Waycross Highway. Also brought to you by Parker Insurance and Realty.